Today we have Dr. Charles Zollinger here with us. He is a general neurologist practicing at NeuroCare Center since 2008. Dr. Zollinger is a medical director of the stroke program here at Aultman Hospital since 2014. He received his medical degree from Case Western Reserve University. He fulfilled his residency training in Boston. He practiced at Dartmouth until returning to his hometown of Canton, Ohio. Today, we'd like to welcome Dr. Zollinger. He's here to talk about strokes, and I see him. Okay, welcome, Dr. Zollinger. Thank you for being here with us today.
Good afternoon. Sorry, I was running a little late from a myriad of things. Traffic is busy in Canton today, evidently. So thanks for inviting me to come speak with you about stroke, and we're going to focus on stroke risk factors and how to prevent stroke really is our goal. We prepared some slides to march through here to review what exactly a stroke is, some of the statistics around stroke, talk about stroke warning signs, risk factors, and prevention, and then really open to answer questions or direct a conversation if anyone wants to or has issues they'd like to discuss regarding cerebrovascular disease or stroke. So there's our agenda up on our slide, and we'll march through it here. So stroke, unfortunately, is very common. Just under 800,000 people suffer stroke in America every year. And a fifth of those, 2/3 of those, are people who have had stroke before. So they've had previous stroke. And up to 80% of strokes can be prevented if we could control all the risk factors that we can manage. High blood pressure is the most common cause of stroke, both ischemic or blood clotting stroke or bleeding stroke is uncontrolled blood pressure. And that's a tough one because people don't know they have high blood pressure unless they measure it. So it's so important to become aware of some of these things you have to investigate or know about in order to prevent them. Stroke used to be the third leading cause of death in the United States, and thanks to stroke awareness and prevention control, we've dropped down to the fifth leading cause. It's still an awful high number there, but we're making progress is the point of that statistic. Unfortunately, stroke continues to be the leading cause of long-term disability in people. So lots of people, unfortunately, are involved in stroke. Every 40 seconds, someone in the United States has a stroke. And every minute that a stroke is left untreated, 1.9 million neurons die. We don't have that many to spare, so this is not good. Every hour that a patient is not treated, the brain may lose as many neurons as a normal 3.5 years of normal aging. So time is brain is the saying in stroke treatment, meaning if a patient has signs of a stroke, we need to intervene as soon as possible. Every minute we wait, more brain is damaged. So time is brain. So what is a stroke? I mentioned this just a few moments ago that there's different types. Stroke essentially is brain damage. Part of the brain is no longer functioning. And why? The most common is what's called ischemic stroke or lack of blood flow to the brain. And that's this diagram on the left. So that for some reason, the arteriole, which carries our blood to the brain, is blocked off, either at the source here or somewhere closer to the heart. And all the brain downstream from that blockage is injured. That's ischemia, a medical term for lack of oxygen or lack of blood flow. And that area of tissue becomes damaged. The brain cannot function without its normal blood flow because it needs the oxygen and the glucose and to take away byproducts. And as soon as that vasculature is compromised or the blood flow is compromised, the brain becomes symptomatic, or you start knowing there's damage to the brain. Less common would be a hemorrhagic stroke, which instead of a blockage in blood flow, there's actually a rupture in an artery. People hear about aneurysm rupture probably most commonly as what people think about as a bleeding stroke, but actually more commonly is not an aneurysm, but rather it's a little blood vessel called a penetrating vessel the wall weakens and breaks, as opposed to an actual bubble or berry aneurysm that breaks down. Both a blood clotting stroke and a bleeding stroke are going to look the same to the patient and the family members around. It's a sudden onset of symptoms reflective of that damaged part of the brain. So the effects of the stroke, it really depends on where that blood flow is compromised. And this is just a cartoon of the different parts of the brain that we break down as we think about the major divisions. Depending on where that is what the patient will present with or what they'll be showing. So what does that mean? What are the signs of a stroke? Most overt or most obvious are weakness. So a paralysis or a lack of strength on one side of the body or the other, usually in the face or an arm or a leg, usually all three on one side or the other. Our brain is divided and wired in such that the right side of the brain controls the left side of the body and vice versa. So if there's damage to the left frontal lobe up here, the right side of the body shuts down and presents with weakness. Other symptoms would be slurred speech, usually from weakness of the mouth. Then there's not just slurring of words, but trouble forming words. We call that an aphasia or trouble with the language, such that the patient will know what they want to say, but they can't get the words formed, they can't spit them out. On the other side of that is also comprehension. So they can say words, but they're not making any sense. Those are all signs of stroke, either, again, blood flow or blood clotting. Less common, but also out there, are coordination and balance. So if you get the back of the brain, it can affect your ability to move in a coordinated fashion, as if the patient were intoxicated. Facial droop is just another form of weakness. Lack of sensation or numbness on one side of the body that comes on all of a sudden, so you just feel Novocaine all the way up and down the body, can be a sign of a stroke to the parietal lobe, which is more in the middle of the brain. Blurred vision can be lack of blood flow to the eyeball, which is a form of stroke, or double vision can be lack of blood flow to the brainstem, which is the very base of the brain. So in general, any sudden onset of neurologic dysfunction, a combination of weakness or numbness or language trouble, vision, balance, can be representative that the brain is not happy, that part of the brain is not getting good blood flow and is forming brain damage. This is a big red flag of you need to get to the hospital and try to restore blood flow as soon as possible. So there's an acronym out there you'll see sometimes on billboards or posters, or if you happen to come to stroke events, or we like to get it out in the community, called Be Fast, an acronym for these symptoms that we just marched through. So B for balance, E for eyes, so double vision or blurred vision, face, meaning face droopiness, arm, weakness or numbness, speech, dysarthria, meaning slurred speech, or can't get the words out like an aphasia, and time, meaning act fast, get 911 to come pick you up, get to the hospital, because we have a very narrow window to try to reverse these damaging symptoms. The faster you get in, the more likely we are to try to intervene. There's really a narrow window of time for certain interventions. So you'll see this is our poster. You'll see up there's kind of cartooned: be fast, balance, eyes, face, arms, speech, and time, meaning call 911 now. So it's a public education poster to try to get out there. It's a lot of words on there, but we're trying to get the message out that stroke is something you need to take care of right away. For a long time, people wouldn't recognize the symptoms of stroke, so wouldn't realize they need to do anything about it. As opposed to a heart attack, people say, oh my goodness, I chest pain, I feel like there's an elephant on my chest. This is a heart attack. I need to go to the hospital and be treated right now. Well, stroke is a brain attack. And so when patients have, oh my goodness, my face is droopy and my arm is weak. I'm having a stroke. I need to go to the hospital right now. And some people will call them brain attacks. So you say heart attack because it's the same idea, lack of blood flow to the heart. Well, a stroke is a brain attack. It's all of a sudden damaging going on to the brain, and it's an emergency, and you need to be checked out right now. So what can we do? Why do I make this argument to get in there right away? If it's a blood clotting stroke or an ischemic stroke, there is medication to try to reverse the damage right now. That's a strong blood thinner called tissue plasminogen activator, and it's infused if they can identify the symptoms fast enough and there's no bleeding in the brain, then a strong blood thinner can be given to attempt to restore treatment. Of course, if it's a bleeding stroke, we don't want to do that. That would be contradictory. So right away, you have to do a CAT scan to figure out which type of stroke it is. So if patients are coming into our emergency room, they will immediately be sent to the CAT scanner, which is an X-ray of the brain, to look for blood. And if there's no blood, then we think the stroke is blood clotting, and they can be treated with the blood thinner. The next step is, can we do anything more aggressive? And sometimes we can get a catheter into that clot and take it out. That's called mechanical thrombectomy. Much like patients have heart catheters to look at the heart blood vessels, we now can do brain catheters to look at the brain. And if there's a big clot there, actually snag it, physically use a device to retrieve the clot. And this is a cartoon of that idea of they put a catheter through, they put a catheter through the femoral artery and snake it up past the heart and then up into the brain. And if you find in a large vessel one of these clots, they can retrieve it. So a stent retriever or a clot retriever. And this is actually a clot they pulled out of someone. It's pretty amazing that they can get in there and restore blood flow. Right now, I don't have anyone who can do that locally. I've got to send my patients to Akron or Cleveland, but just all that much more important to get this done as soon as possible because there may be some travel time involved. So what are the risk factors? Like who ends up having strokes? Stroke is really vascular disease. It's plumbing. The brain isn't the problem. It's the blood flow to the brain. And so when I talk to patients about stroke, we're trying to keep the blood flow as healthy as possible. There's some things you don't have any control over, and these are identified here. Age is a risk of stroke. Unfortunately, as we get older, we're more likely to have a stroke. Sex is a risk. Women have more stroke than men, either because of estrogen or because of smaller blood vessels, or because women tend to live longer than men, and thus age becomes an issue. Family history or your genetics really play in all of these issues. Your genetics make up who you are. You can't control them, but there is a family history risk factor. If your family has lots of strokes, you're at risk for them. And race. Certain races tend to have more strokes than others. African American, Asian populations tend to have more strokes. You can't control anything about it. It's not worth dwelling on these, but it's good to know what the unchangeable risk factors are. Now, fortunately, there are modifiable risk factors. So these are things that everybody can do to reduce their stroke risk factor, and there's a lot of them there. And there's no surprises here. These are things that doctors have been telling you to do forever, meaning live a healthy lifestyle. Specifically, what can you do to make your blood vessels healthy? So these are the risk factors that we talked about patients once they've had a stroke, but I'd rather talk to them before they have a stroke, primary prevention. So I'm going to read them out to you here. It's high blood pressure, cigarette smoking or any tobacco smoking, being overweight, not treating your underlying medical conditions such as diabetes, high blood pressure. And so people who are non-compliant are more likely to have a stroke. High blood sugar or diabetes. Having a stroke in the past is actually a risk for having another one in the future. Stress, taking extra estrogen having high LDL or the bad cholesterol, a heart condition called atrial fibrillation, too much alcohol drinking, diets in high saturated fats, trans fats, and salt, which contribute to bad cholesterol, high blood pressure, and diabetes, uh, being stagnant or lack of exercise, narrowing of the carotid arteries, drug abuse, cocaine in particular, tobacco as well, and having obstructive sleep apnea. Now, there's nothing up there that you say, oh my goodness, that's a surprise. I didn't know smoking was bad for me. But it really, all of these things contribute to vascular disease, narrowing of the arteries, calcifying of the arteries, cholesterol in the arteries. That's where stroke comes from. And these are all things that are treatable. They're identifiable and treatable through medical screening. So if they're modifiable, well, what's the modification? What can you do to lower the risk? Well, keep your blood pressure normal. The goal normal blood pressure is 120/80. The lower the blood pressure, the better. The only thing limiting low blood pressure is feeling dizzy, or feeling faint if your blood pressure is too low. But your goal should be normal blood pressure. If you smoke, stopping makes a big difference. Every year you quit reduces your risk even more. If you're overweight, losing weight through appropriate diet and exercise to achieve a normal weight ratio to your height will reduce your risk of stroke, heart attack, diabetes. All of these things can be reduced by getting weight down. If you are treated for the conditions mentioned, being compliant with your medication and your follow-up visits and your tests make a difference in protecting you against bad vascular complications, such as stroke or heart disease. Blood sugar, you want normal for average 80 to 130. Fasting blood sugar should be under 100. Your hemoglobin A1C, which is your average blood sugar over 90 days, should be less than 6. And these can be achieved through medication, diet, and exercise. If you can avoid extra estrogen, then you should avoid extra estrogen. Stress reduction through meditation, counseling, lifestyle changes can reduce your risk. Avoiding extra salt or avoiding adding salt to your diet reduces blood pressure and stress on your vasculature. Getting your bad cholesterol or your LDL less than 100 for all comers. So everybody's goal, whether or not you've ever had a stroke, should be less than 100. If you've had a stroke or a heart attack, we want even better. We want under 70. It's very hard to do without taking medication, but between diet and medication, you can get that LDL down. The rhythm atrial fibrillation, which is a heart rhythm of irregular beats, causes stroke and can be treated with blood thinner called anticoagulants. So if you have atrial fibrillation, your chance of having a stroke is greatly reduced if you take anticoagulants. Not abusing alcohol and reducing indulgent in alcohol will reduce your stroke as well. Reducing fats, trans fats, and salts again with your diet. Exercise. They want 40 minutes of moderate, vigorous exercise 3 to 4 days a week. What is moderate to vigorous exercises? We want you to break a sweat. We want you working hard enough that it's hard to carry out a conversation. Now, anytime you start an exercise regimen, you need to make sure your doctor says your heart's healthy enough to do it. If you've had heart disease, you probably need to get clearance from your cardiologist. But if you don't have a history of heart disease, we need people to get out and move, start walking, break a sweat, make it hard to have a conversation. That's moderate to vigorous exercise. If your carotid arteries are narrowed, doing all of the above things that we just talked about will help reduce them. And if that's not enough, they can open up those carotid arteries with surgery. Stop doing cocaine. If you take cocaine, that's not good for your brain and it causes stroke. So stop doing that. Nicotine would be the same argument. If you're using nicotine in any form, stop doing it. Causes stroke. And finally, treating sleep apnea. That changes the pressures on the brain. So, sleep apnea is when you don't breathe well at night, and it puts pressure on the heart and lungs, which then put pressure on the blood flow to the brain. That is an awful lot of words, awful lot of information. But these are the things that we can do to make changes to get that number even lower. Every 40 seconds, someone's having a stroke, and 80% of them could have been prevented by changing these 12 things, or sorry, 16 things. So, I mean, it's work. None of this stuff is easy, but it really is making choices about your lifestyle and what you do for better health. So, what do? Uh, Talk to your primary care doctor. How can you take control of your life and prevent disabling effects of stroke by controlling the risk factors? And the ones that really everyone can do right away is exercise more and make good choices about what you're putting in your body, about what you eat, what you smoke, or other things. If you just move better and exercise more and eat better, you're really hitting a lot of those modifiable risk factors. So I talked relatively fast. I apologize, trying to get through all my risk factors, but we went through statistics. What is a stroke? What do we do if we have a stroke? What are the risk factors? How do we prevent them? And just summarized here.